Thank you very much, and I really appreciate being able to speak about this really important topic amongst some really interesting conversations that we've had already. So when I was diagnosed back in the 80s, some of those key organisations that we know so well now, and the concept of engaging with the lived experience really were just developing or didn't really exist at all. So I was really fortunate to be part of the change, and that's how I really learned and gained my experience. The cancer domain's been one of the leaders in this field, and it's been good for me, and I think it's good for any consumer involved in this aspect of advocacy to understand where we came from, because it helps us to do better as we move forward. And because I was diagnosed so long ago and became active so long ago, my experience is quite varied, and I've been so fortunate to be involved in research myself as an investigator. But most of my experience does in the, I guess, the research side of it does come through my involvement on Consumer Advisory Panel, first of all with breast cancer trials, and I was there for 20 years with them, and they were one of the first organisations in Australia to have a consumer advisory group, and I was chair of that group for some time. And now I'm on the Consumer Advisory Panel with ANZUP, which is the one that looks into urogenital and prostate cancers. So there's going to be a few themes that are running through my presentation today, and I think they're really key to involving successfully and engaging successfully with that lived experience and consumers. And in no particular order of importance, the first one I'm going to talk about is to avoid just ticking the box. And it very often occurs because of time constraints and just lack of resources, and sometimes people not knowing where to start and where to find the right people. And education for new research is about how important this is. And my next one I want to talk about a little bit is that notion about not one size fits all. And so often we see people being asked to be engaged in research just because they've had a particular health experience. And what I'm saying throughout this presentation today is that not every role doesn't fit every person. And so not everyone has experience to be able to be involved in every area or the interest. So I'm saying you just can't pull the name out of a hat and hope that it's going to be the best result for all. The next one is really the labels that people with the lived experience are referenced to. And I think this is where a lot of the misunderstanding comes from. So I will use the term consumer today because it's the one we know the best. It's one that's used the most. To be honest, it's not my favourite term, but like everyone else, which one do you use? It's very hard. But I think, this is part of the issue. So healthcare consumers describe a healthcare consumer as anyone who uses, has used, or may use any health or related service. So that's what I'm saying. This is where the confusion might begin, because a consumer might be an experienced consumer advocate or member of a research team. They might be a potential study participant. They could be a member of a focus group. They could be just somebody in the general community who wants to give back and be a volunteer, raise funds for research, or be a member of a support group. And really none are incorrect, because we're all consumers of the health system. But a potential trial participant or a focus group attendee has a very different role to the consumer member who's part of a study team contributing to decisions around that research and that study. And not to forget too that health professionals are advocates for patients, but they are not patient and consumer advocates in the context that we're talking about today. So, very different roles, but we're all called consumers. So way back in 2011, and it is a long time ago, I know, but Cancer Australia produced a national framework for consumer involvement in cancer control. And I think it's still quite relevant in what was found. And it was really an example of practicing what you preach, because this body of work included health professionals, and researchers, policymakers, and importantly, it included a large cohort of consumer advocates, and I was one of them, so that's why I can speak to it. One of the chairs, the co-chair, was a consumer who's very experienced and well informed and knowledgeable. So that had total engagement as far as I'm concerned. And it identified 4 areas that were of importance. That was committed organisations, capable consumers, inclusive groups, and having a shared focus. So, and what they found in that description of inclusive groups, I think, covers all of those, because champions are absolutely needed by us as consumer advocates, because without having the champions within the organisation to help open the doors and help us push forward our voice, then it's just our voices don't get heard. And I can speak to many times that I haven't been able to do the things that I have been able to do now without those great advocates for me and champions for me. Mutual respect really encompasses all of this too, and it encompasses equality, because when we have mutual respect, that equality and being part of the team all comes together. We have mutual development around learning together, and as consumers are experts by experience, even though we might not have a degree in something regarding research, we bring that different knowledge and that expertise around it. And of course, mindful communication between everybody is the key to being able to work together as a team and collaborate. So really, just to reiterate my point about the importance of understanding the different ways consumer advocates provide input and where and how that input can be utilised. And so this also came from that work with Cancer Australia, the all, many, some, few. And I really like this triangle because I think it describes very well where different people fit in, because we all have an experience with the health system. So everybody can give an opinion about that somewhere along the way. Many people decide to give back and provide general feedback, fill out surveys, they volunteer, and their voice is absolutely important in developing different processes in different systems, etc. Some people go on to be trained consumers and become advocates and advisors and reviewers and become part of grant application committees and different more involved areas of research. But very few really are there when you really look at how many people have any health experience who are involved with research and being part of governance committees and being part of the team. I found this really great article that was titled From Passengers to Copilots, and I really like this description of where we have come from since those days that I talked about when I was first diagnosed, and it was really not even heard of so much back then, because we are now co-pilots in our decisions around our care. But what I do say to consumer advocates is that there's an aspect of responsibility in this, in being careful what you wish for, because so much work has been done over the years to make sure that our voices are heard, that consumer perspective is always there, that the onus is on us to do a good job and to act professionally and to uphold the good names of those people who work so hard to make sure this was practiced as it is today. And so that's what I referred to before when I said it's really good to know where we came from, to know how we can move forward. But, you know, there definitely are some challenges, that's for sure. And very validly, people say, well, how can a layperson understand the science and what can they possibly contribute at this level? So really the consistent message is that consumers bring a perspective of their diagnosis and experience. something that's unique to them and their lived experience. They also bring a wealth of diversity and knowledge and capabilities. And above all, they bring that motivation to improve outcomes and the ability to ground the research in the lived reality. I'm not saying either that the researchers don't know this, but when their focus is on different things around how the research is being conducted, what the statistics are going to be, all of those different areas, that's where that consumer voice can bring it back to that lived reality. So there are very many ways that people with the lived experience can be involved in a research project. And this is a little bit messy, I know, but I like that because it's showing that there are very many ways and it's just not at the end. So I started to create this diagram of my experiences within the clinical trials groups. And as I went, I kept on adding all these little circles that I thought of different things that came along, and the circles just kept getting smaller and smaller because there were just so many different areas that I've had the privilege of being involved. And with both the groups that I've been involved with breast cancer trials and with ANZUP, we are involved right from the very beginning of concept development. We're in the concept development committees. We have that ability to have a say about how things go forward. We have the ability to direct where the funding goes to, because we're on the funding grant funding committees as well, and our voice around that has great weighting. And of course, we review all the documents, especially the ones that go out to patients. Some of the trials that I'm involved with, I'm on the governance committees and the steering committees. So there's every single one, there's many, many different ways. But of course, one of some really key ways that we have involvement is around communication. And I think you'll all agree that the conversations that scientists might have are very different to those with the public and community. And so it's like, you know, apples and oranges, really. There are many clinical terms that are not readily understood by the lay community. In the cancer world that I know more about and work in, there's a couple, you know, words like aggressive and invasive are commonly used in cancer conversations, but to a patient they mean one thing, but to the clinician it might mean something a little bit different to what they're thinking about. So a helpful consumer representative can draw attention to these sorts of things in the patient information documents that go to a patient about a clinical trial, for instance, and they can suggest alternatives. And this helps the message then to go out to the community way better and connect with the people you want to connect with and recruit a lot better as well. Another way this feedback is invaluable is to engage in writing a lay summary, for instance, for a grant application. So like I said before, we might not be scientists and understand the science, but some people are. But this is a great place for an informed consumer who's worth their salt to be most helpful. And I say this to researchers, if you're not doing this and not engaging with consumers this way and getting this sort of feedback, then you're missing a really great opportunity to have that input from them. A consumer reviewer of grant applications, as a consumer reviewer of grant applications, I can tell you that it makes a big difference how your application is considered when it comes to that committee, because people know what good consumer engagement looks like, and it's very obvious when it's not, hasn't been done properly, and so it can influence how that feedback goes to the weighting of your grant applications. So how to develop inclusive and effective committees, and Natasha mentioned some of these things too, and I've already mentioned some of them as well. It's around training, it's about having champions, having more than one person on a committee is really good for a number of reasons, because you get not just one voice, but it also helps that consumer representative to feel like they've got someone who they can communicate with a little bit better, they fit into the committee a little bit better and feel more comfortable about having someone they can bounce off as well. Some of the do's might be, how do you do it? Because that's sometimes what people say to me, well, I don't know, if I'm doing some research in the laboratory, how do I get someone to understand? Well, it's about connecting, putting information out there, telling people what you're doing. Could be through emails, Zoom meetings, lots of different ways that are available now. You can invite feedback about what you're thinking about doing and what that research might be and what those policy directions would be. Develop a rapport with individuals who have got some backing and experience and can give you good, honest feedback. And this is where experienced consumers need to be engaged, because sometimes people who don't understand it might not be able to give that feedback that's most valuable to you. And it's about, when I said before about not ticking the box, I think that also refers to the consumer representatives too, for us to do a good job and to not just tick the box and say, yes, I'll be on your grant application, and yes, that's okay. And I'll tell you a little quick story. I was talking to a support group one day and talking about moving forward after a cancer diagnosis, and I said, these are the sorts of things that I do. And a lady came and spoke to me and said, oh, well, I've been involved with research as well, and a researcher's asked me to be involved in his grant application, but this is the feedback I gave. I'm an animal lover, and what I said to him was, well, what do you do about the mice? Because I hate to think that the mice might be being damaged or hurt. And when I asked a few more questions, that's basically all the feedback she gave. So fortunately for that researcher, she gave him my name and we were able to communicate, and I was able to kind of give him a little bit more feedback around his research. So that's what I'm saying about having the right person. I can hear some. Getting the right person to be able to give you the feedback. And it's about asking for information around help in developing community directions as well. And there are times when consumers can be involved in steering committees and being involved as associate investigators and chief investigators too. It doesn't always apply to every place, but it certainly can. And it's about keeping involved in that. Let the consumer know how your grant application went. And it occurred to me when I was preparing this that the researcher in the mice story, he never got back to me and told me how he got on. And I was, I helped him in a day's turnaround and spent many hours working with him on that. So people do invest a lot of their time, so it's good to get some feedback as well. So in summing up, effective consumer engagement is really about making sure they've had good hands-on training, including mentoring to support them in what they do and developing their experience and their networks and their knowledge. Like I said, it's about matching the person, the right person to the role, and that's going to make a huge amount of difference. And it's going to end up making sure that everyone has good experience, the clinicians and the researchers and the consumer advocate, and better results around what that research is. Because when you've got the right role for the consumer, then their contributions can be enormous and very valuable. People might need some encouragement about what they do, but you might see that somebody's got real potential. So it might be just about nurturing them and guiding them through that training and making sure that they've got the good backing to be able to feel confident in what they do. Because it's a bit daunting when you go and sit at a table with a whole bunch of people who are really knowledgeable about science and health, and we don't always come from those backgrounds. But everyone does have a role to play. And it does make a difference if you've got the right person there. And there are some places that you can go to for consumers to have training. Natasha mentioned and Mackenzie, but also there's a few different places, and I'll just mention here that a colleague of mine and I, we've started doing that up here in Queensland, because with my practical experience and her research experience, we were able to bring that whole sort of training. So if you want to know more about that, you can always let me know, but there are different places to go, and it is really important. So experience and patient advocates are not only the voice of the community, but they understand the concepts. And as David Green quoted, by connecting and being part of a community with a shared vision and goals, we can create great things. Just remembering that consumer community engagement is not just being tokenistic. It's not just where people are easy to reach, not just the same ones all the time. You'll just, may not represent a whole community, diversity in that voice. And it's not just a single process, not just one off at the last minute when you can't find anybody else. A seat at the table means making a start and including the lived experience in the conversations. And to me, this means not only when it's convenient, but through the whole process, when the whole team is being chosen and selected and called upon. And, there are different ways that people want to be involved, and the conversation around paying consumers is one that's really needs a little bit more talking about. I think there are times when it's really important, but not every time. But that's probably another conversation. So a seat at the table means you're a part of the conversation. I think it's probably the most important thing, not just ticking the box and getting the right person for the role. So thank you very much. That's from me.